to and share our activities in Brazil connected with the Pan American Health Organization. Then the stars here, you are supposed to be in San Diego presentially, and the other star is São Paulo star. We are very connected to the same America continent, but in different cultures. Our vision are connected with that image of multidimensional human being that includes several levels of consciousness and even biological level until the ambiental and social level. Our core values are inform, evidence, representative leadership, integrity, interprofessionalism, because we include several professionals, academic community, transparency, ethic, and the national and international collaboration. Our mission is to contribute to the scientific validation of integrative and complementary approaches in health through the systematization and production of studies and research, increasing the visibility of scientific knowledge in the area and promoting exchanges and collaboration among researchers, universities, and national and international research groups to support the implementation of the traditional complementary integrative medicine, the WHO expression, in an integrated manner into the public health system with safety, effectiveness, professional qualification, quality of services and products. To do this, we need, of course, a big network. The board of directors are composed from me as a medical doctor, Caio Portela, a naturopathic doctor, with master degree in the field of pain, and the nurse Gelsa Matos Nunes that are doing post-graduation in the field of pain also. We launched our consortium in a big conference for 4,000 people in the first International Congress of Integrative and Complementary Practice in Public Health in Rio de Janeiro, where attended Dr. Zhang Ti from WHO. During that important Congress 2 years ago, we joined several groups, even the academic consortium, and from several countries together with WHO. In the same time, the Minister of Health personally announced the third stage of implementation of integrative medicine in the country. We have, in the last 14 years, 29 modalities of complementary practice included in the policy, national policy of integrative health. Starting in 2006, were included basically the systematic medical system, the medical system, that means the traditional Chinese, homeopathy, anthroposophic medicine, and also phytotherapy and thermotherapy. After several years, in 2017, the policy opened to Ayurveda and naturopathy, meditation, Reiki, music therapy, art therapy, dance therapy, chiropraxis, reflexology, Shantala massage, and a specific Brazilian made practice named integrative community therapy. And during that Congress in 2018 was approved in the health system the last group of apitherapy, aromatherapy, ozonotherapy, bar therapy, geotherapy, hypnotherapy, familiar constellation, bioenergetic, and chromotherapy. Like you see, it's a big policy. It's a big challenge to support from the evidence-based all that practice. Specifically, I would like to emphasize the integrative community therapy, that it's an instrument for action and reflection on mental health, open to all individuals who are experiencing crisis situation. It's a very important and effective approach to mental health. Nowadays, are spread around our country and also in 27 countries beside Brazil. It's a light and relational technology in mental health care, feasible with low cost, no medical effective for relief the suffering. In that case of pandemic, there is a lot of work doing with that group. It's a big group, an important approach. And there are some new research showing the impact in the mental and emotional health and social and strengthening the bonds and space of sharing, and also spiritual and biological impact. In the same moment, during that Congress 2 years ago, was launched the TCIM American Network that start the history in Nicaragua, where we meet in the meeting Advancing Toward Universal Health, where several countries participate also. Then our Brazilian consortium belonged to that big network that engaged around 16 countries and several universities, like Argentina, Bolivia, Chile, Colombia, Ecuador, US, Guatemala, Mexico, Nicaragua, Paraguay, Peru, and Venezuela. One important product from that network is to create a virtual health library devoted specifically to integrative medicine and health, that it's a point to search more than 1 million publications that are reflected in our website also. And this is the website. And through that website, you can also search in all database like Medline, PubMed, but also were created on a specific database named Mosaico that joined basically gray literature like PhD thesis and master degree dissertations that are not published, but are very important in our field. In the website of the Brazilian Academic Consortium, we have the possibility to translate to more than 10 languages, even in Chinese. We create that possibility to increase the access. And some months ago, also, we participate in that group of ISCMAR, that means the International Society of Complementary Therapies Research, that has a chapter in Canada, China, Korea, and Iran. And recently we became part. We started to participate in the WHO benchmark that discuss the minimum curriculum for several practices. And in 2 years ago, we start to communicate with the academic consortium and also with the Dutch consortium, because with that name, we recognize that three group. After 12 years, that means 2 years ago, that policy promotes the implementation in a very specific way, basically in the primary care. I believe that Brazil is nowadays one of the case where the integrative medicine is spread basically in primary care. We can say that 78% of in the public health system are in the primary care. The last survey shows that 90% are in public health system in more than 4,000 municipalities. That means 77% of all cities in the country, at least one practice. And when we survey the profile of professionals that do research in integrative medicine and health, we realize that the nurses are the main group, followed from the medical doctors and the physiotherapists, pharmacists, and psychologists. Then our consortium became open to discuss directly with the federal councils of each of these groups. One specific survey that come not for us, but from the Observatory of Practice from the Fiocruz, that another important group, sister of us, did a research of groups that have included in the Ministry of Health system, and realized that more than 60% are in the field of phytotherapy. Then they have 600 groups. Then we start to join the researchers in committees, and the main committee related with medicinal plants are the Natural Product Committee. Then we create the PEN Committee, the Integrative Pediatric, that I'm the leader as well, and Integrative Oncology Committee. Our policy and our interest is create collaborative network. Then we have the important meeting in the NCCIH, and together with the NCI in the first meeting. Then receive Alejandro Salicrup from NCI to visit our NCI in Brazil, that it's very open. Doutora Cristina Pinto, the blonde woman in the center, she's the director of the NCI in Brazil, and completely open and in favor of integrative oncology. And also we started to think about how to translate good materials in integrative oncology. That course in the Coursera from the Technion University, led by Aaron Benaidi, have a wonderful course about traditional herbal medicine in supportive cancer cares, and that involves several hours. Then we start a project to translate to Portuguese and support the German and the Italian group as translating, because we have one facility that one of our co-chair is very good in the IT, Caio Portela, and we started to collaborate in the translation to allow a quick process of translation of the subtitles. In that field of oncology, I'd like to share also an important study with a medicinal plant from Amazonia, because as you know, Amazonia area is nowadays under terrible problems, and we believe that it's very important to promote the care and the safety of the Amazonia forest through the studies of medicinal plants there, because you have a lot of interesting possibilities to research. One specific plant, cat claw, that's Uncaria tomentosa, show in cancer patients improve of the reduction of fatigue related to cancer. It's a very interesting work what was done from Auro Del Giglio, that head of one of the biggest center of oncology in public health system. We did also last year the International Symposium of Integrative Pediatrics that joined 12 countries, including North America, Europe, Latin America, and East Europe, in that field, and we create a São Paulo statement that we will publish in the next special issue about integrative pediatrics this year. And what are our important field of research? Besides medicinal plants, certainly are the traditional Chinese medicine. I found a paper that showed the status and the impact of acupuncture research, a bibliometric analysis. It's not so old. It's from the last 14 years until 2014. That shows that comparing with the number of publication in general, that Brazil it's in 13th place. In the field of acupuncture, specific publication are in the 7th, and more specific to the some other publications in acupuncture are in the top 10 most productive countries in the world. This is very interesting because you couldn't imagine such influence, but it's very strong. Other example of collaborative study in the field is in the field of nutrition with children with nephrotic syndrome, resistant of corticoids. Is a very complex group of patients that needs hemodialysis. Frequently, it's very complicated and needs very complex drugs. In that study, that's a collaborative study with Boston, Harvard Group, and São Paulo University, my university, that shows after a camping for only 4 weeks with a diet free of gluten and dairy, reduction of proteinuria, and the improvement in the kidney function. The conclusion is that gluten-free and dairy-free diet can be useful in management of difficult to treat nephrotic syndrome in children. And that specific project had a very important and severe impact in the biggest hospital of pediatrics in the country, the Institute of Child, because the nutrition group became open to change completely the vision about nutrition. And looking to the scenario of the medicinal plants in Brazil, I'd like to also to say that we have indeed 5 different countries. If you look to the biome or biota, it's completely different. That plant that is typical from Amazon area, babaçu, or Bignia speciosa, showed an antinociceptive effect that became an opportunity to research in the field of pain. It's a very interesting plant that was being studied in the last years in Brazil. And also, that plant show a potential alternative to benign prostatic hyperplasia. And several studies in nanotechnology also share the same results. Another plant that are being studied, it's Euphorbia titucali. It's very common in Brazil. That shows also anti-proliferative activity, that means opportunity to study in cancer area. And we started some months ago US-Brazil collaborative research to allow further development of that clinical research, because now is the moment to the clinical trial development. In the collaboration with Switzerland, the VISCO album is very common in Europe as an integrative oncology approach, and the group of Carlo Langino, that's the head of the Natural Product Committee, established the new field of research in metabolomics profile of VISCO album in several host trees, showing new possibilities to develop of a new area of application, because usually are needed injections, and through the new studies, a new postdoctorate thesis show absorption to a transdermal gel that opened the possibility specifically to pediatric cancers that don't fit very well with injections, of course. And to conclude, I'd like to show our more important contribution to the Ministry of Health and in general to that field of integrative medicine, that they are the evidence map. The evidence map of clinical studies are based on collaboration with the Virtual Health Library of TCIM America, AIHM, and it concludes the 12 evidence map that you can search in our website in the field of acupuncture. And the studies are the reviews, basically the systematic reviews, but also meta-analysis or without meta-analysis. The systematic reviews from the clinical trials are the basis to create that map. Then I can't show you the results because I don't have time, but I'd like to share in which field of integrative medicine and health we did that maps. Acupuncture, meditation, that's the biggest map. Medicinal plants for metabolic and psychological disorders. Also medicinal plants to control the pain, to yoga, medicinal plants to mental health and quality of life, auriculotherapy, ozone therapy, reflexology, TCM, traditional Chinese medicine, oral ozone therapy, that's different from medical ozone therapy, Shantala, and with the partnership with the big field of the TCIM network, we did recently also for COVID-19, and in the July, we could share the results in an international symposium in an online basis for more than 5,000 participants from 12 countries. We published that evidence map for COVID, showing the benefits in the immune system, mental health, and the respiratory common symptoms. From that maps, then we started to create a center of knowledge translation led from the Ministry of Health. This is not a project from the consortium, but we are partner writing together with some colleagues from the BIREMI, the Virtual Health Library, together with Ministry of Health, specific materials to specific themes like chronic pain, hypertension, and depression. And what's your main goal? Establish a worldwide network of integrative medicine institutions, national consortium, and research institutions in collaboration with TCIM, of Traditional Complementary Medicine Unit of WHO, with Zhang Qi, that's the leader to create, to foster that international collaboration. And the topics that we addressed with the possibility for international collaboration are in the field of research, clinical care, education, communication strategies, mapping and developing an international directory of TCIM groups, support the creation of other academic consortium. Then looking to the world, the WHO divided in 6 regions. We are in the Pan American Health Organization region, since Canada to Chile. And our dream is that our field could be connected in a very good way, lovely way. And I believe that Congress and the Academy of Integrative Health and Medicine, it's very strategic to create that network as well.